Hi, my name is Kennedy Rodgers. I'm in the traditional nursing program, and this is my final capstone presentation. The public issue I chose to research and present was homelessness in Minnesota. I will soon be a resident and practicing nurse in Minnesota, so I chose this issue because homelessness is a solvable health crisis in America. However, the resolution to homelessness is not prioritized by the policymakers in our country. The Minnesota Homeless Study found that homelessness has been on the rise since 1991. And through education and personal interaction with a variety of unhoused individuals, I've become very much aware of the detrimental health consequences of this public health crisis. I strive to contribute to the elimination of homelessness to promote positive and prosperous health outcomes for those in my community. You may find it easier to understand my passion behind this issue if I share one of the quotes that I choose to live by from the feminist activist Angela Davis. It goes, "I am no longer accepting the things I cannot change. I'm changing the things I cannot accept." This quote fuels and empowers me to use my knowledge and platform to create significant change in our country. As a future healthcare provider, I find that my duty is to act as an advocate for vulnerable populations that our national leaders disregard. I find it my responsibility to generate changes in our society, which will lead us toward an equitable and equal culture, fair and safe for all. Engaging in relevant, influential conversations and communicating clear ideas through proper techniques of correspondence to ensure effective communication is a proficiency of an educated citizen. Teaching is an occupation that requires specific communication due to the range of ages served, as well as interprofessional collaboration that occurs. As a substitute teacher, I must critically think about the age group and developmental levels of each student that I interact with in order to efficiently deliver educational information and to assure thorough understanding from students. I must also recognize the unique social and familial factors that students deal with depending on their residential location, socioeconomic status, and domestic experiences. The behaviors and actions of the students are related to the circumstances in which they live and grow up. This is important to remember when engaging with patients as well. Attentive listening and clarifying details on my part are important factors when facilitating student and patient understanding. I must utilize nonverbal communicative techniques like therapeutic silence to collect my thoughts and execute the applicable responses to students and patients while utilizing my cultural competence to communicate appropriately. Keeping in mind personal situations and experiences is crucial when effectively communicating with unhoused patients, as unstable housing can greatly affect someone's health and their ability to remain adherent to healthcare and treatment regimens. Building rapport and meaningful relationships promotes patient adherence to education and trust between patients and providers. In the ICU, I worked with an unresponsive, intubated, sedated patient. Regardless of the patient's level of consciousness and condition, my intention was to treat them as I would any other patient, respectfully and holistically. Addressing them when I would enter the room, guiding them through each intervention I performed, and ensuring their comfort through observation of nonverbal cues was part of this holistic and respectful care I administered. Even though they could not respond to me, I made sure to speak to them directly and acknowledge them as a person. Touch is an important communication tool that I used when words were unavailable. This method of communication helped create nonverbal rapport and built a trusting relationship between this patient and I. Many forms of communication are necessary to execute the desired message or therapeutic care. Those without stable housing require empathetic approaches to their treatment, and this can be accomplished through therapeutic forms of communication like touch. Body language, eye contact, and attentive listening are other ways to effectively utilize therapeutic communication in the healthcare setting. Being an educated citizen also requires critical thinking and analysis of personal performances and historical events to influence progressive change as a reflective individual. A clinical experience in which I demonstrated being a reflective individual was during my home nursing clinical rotation. I worked closely with an elderly family member of mine, doing health checks and assessments, where I created a routine of reflecting on data, completing patient documentation weekly, and critically thinking of ways to build upon previously discovered data. After spending time with my patient, I would document information and then analyze it accordingly by rereading and taking additional notes so that I may complete a plan of care and hypothetical treatment regimen based on their health history and current findings. I learned to utilize and master my critical thinking and research methods to broaden my knowledge and reflect on my experiences to guide my future decisions in healthcare. The research I accomplished during this experience has further encouraged me to stay knowledgeable and informed about healthcare findings and the systemic issues that create barriers to healthcare, specifically for those who are unhoused, as well as the negative health outcomes that result from being homeless. Remaining knowledgeable about populations affected by this public health crisis and the barriers involved will help guide me in priority setting for treatment plans and referrals in the future. Working in the pediatric clinic for clinicals required a great deal of reflection on my personal background prior to nursing school. As a daycare teacher, a paraprofessional, and a substitute teacher as well as my recently acquired pediatric biological knowledge learned within nursing school. Effective reflection is demonstrated through critical thinking and analysis of past and present situations to guide my future situations and decisions in the nursing field. From this experience, I learned that analyzing the historical aspects of the issue of homelessness and comparing it to the contemporary challenges unhoused individuals face can help in constructing plans that influence progress with this issue and helps eradicate the barriers in place. Acting as a change agent by prioritizing positive, equitable developments in our communities is another aspect of the role of being an educated citizen. During last year's Martin Luther King Jr. Day of Service, I partnered with Together Inc. Omaha and other Methodist nursing staff members and students to assemble emergency bags for homeless individuals in the community. Our goal was to reach 150 bags, and we completed that mission in no time. As a team, we finished almost 200 emergency bags in less than 2 hours, giving us plenty more time to hit the floor of the food pantry, to stock shelves, and interact with shoppers. I have also worked alongside this organization to provide health screenings and referrals to increase access to healthcare services for members of the community. This reinforced how initiating positive change in the community can be accomplished in a variety of ways, including providing necessary items to those in need and implementing necessary healthcare services to those who lack access. In order to achieve a more equitable society, political and societal priorities must shift from economic and infrastructural expansion and profit to an emphasis on total population health and well-being, and the elimination of socioeconomic and healthcare discrepancies. By acting as a change agent, we can help influence this shift in prioritization through patient advocacy and removal of barriers to equitable practices for our patients. Working with the mobile diabetes bus was an important experience during my clinicals. It allowed me to directly interact with and care for individuals of several populations, including people without stable housing or access to healthcare. The unit offers early intervention for potential health issues and offers referrals for follow-up care. Possessing adequate access to healthcare is crucial for positive health outcomes to occur. Vulnerable populations, like unhoused individuals, have the most difficulty accessing health services, and mobile units like the diabetes bus brings health. As I have presented to you today, through each of my clinical experiences, I have learned, grown, and I believe developed into a prominent, educated citizen who has and will continue to communicate effectively, reflect supportively, and influence change in the communities in which I live and serve. Thank you.